Hello everyone, it's Tad from Flourish Medical and Wellness, and this week we've been receiving a lot of questions on weight management and weight loss. So just wanted to take a couple minutes here to give some information on that, and hopefully you find this helpful and gives you some insight and direction with regard to your own weight management. So the big three things that we look at are going to be dietary intake, rest or sleep, and also activity. And really those make up the three key components from a lifestyle perspective that we look at with weight management. When we look at diet, for most people, focusing on lean protein sources, vegetables, and some fruits is going to be the foundation of the diet. Things like excess complex carbs, sugars, processed foods, and alcohol, those should really be limited because those are going to stand as a barrier in the way. And if you always start your plate with a lean protein source and vegetables, it's a good starting point, and then add in around there. From an activity perspective, getting activity every day is really the gold standard. And ideally, there should be some variation there. Some cardio working out, some resistance training, and that is what's going to add to benefits in the long term. Also really work at finding an activity that you like, because that's something that will keep bringing you back. And then for sleep, at least 7 hours of sleep per night is ideal. Now there's lots of sleep trackers out on the market right now, and so do everything you can from a sleep hygiene perspective to get the best sleep quality possible. Being in a dark room, avoiding screens before bed, having a quiet space, a comfortable space, not being too hot or cold, those all go into good sleep hygiene. A couple other things that we've been asked about recently is intermittent fasting and GLP-1 agonists or medications like semaglutide. So looking at intermittent fasting, one important thing to know is that intermittent fasting is not a one-size-fits-all. Most of the information that's out there on the web is going to look at a 16 to 8 fast or a 16-hour fasting window to an 8-hour eating window. And that is a good place to start, but it's not for everybody. Some people do much better with a 14 to 10 fast, where it's 14 hours of fasting and a 10-hour eating window. And some people even do best with like a 12-12 fast. Longer fasts, like a 20 to 22-hour fasting window with one main meal each day, can be done, but there is an increased challenge of limiting portion size and really focusing on specific foods that you're eating to make sure that you're not just reaching for processed foods or carbohydrates when a person is only eating one meal per day. But a 16 to 8 fast is a very good benchmark to start at for many of the benefits of intermittent fasting. And then finally, looking at medications, we've been getting a lot of questions on semaglutide. Common names for this would be Ozempic and Wegovy. Those are the trade names. But that type of medication works in a few ways. It works to decrease hunger and also increase satiety or fullness. And a big part of this is how it slows down the movement of food through the GI tract. GLP-1s, or that class of medication, can be useful in weight management and weight loss, but they're simply a part of it. The other pieces, the lifestyle pieces, really need to be in place, especially when a person loses the weight and then is getting off of those types of weekly injections. So I hope this provides some adequate information for you. Certainly, if you have any questions, feel free to reach out to Flourish Medical and Wellness, and have a great day.